I'm Dr. James Talcott, a physician at Mount Sinai Beth Israel Hospital and professor of medicine at the Icahn School of Medicine at Mount Sinai. I'd like to thank the editors of BJUI for allowing me the opportunity to describe my findings that have been highlighted as an article of the week. The protocols for standard cancer treatments are increasingly complex, yet they can vary according to provider preferences. We rarely evaluate or compare alternative treatment protocols. Patient-reported outcomes, or PROs, are accurate and valid measures of patient outcomes, yet they're highly underutilized. We report an unplanned use of PROs that found and corrected a harmful change to the protocol for delivering prostate brachytherapy. In prior work, we found that prostate brachytherapy often produces long-term urinary incontinence. To reduce it, an experimental protocol used MRI imaging and dramatically reduced the radiation dose to the periurethral prostate. To assess the new approach, we compared it to standard ultrasound-guided prostate brachytherapy at two other Boston hospitals, USBT-1 and USBT-2. Unexpectedly, one standard treatment, USBT-2, produced excess levels of short-term urinary toxicity. The treating radiation oncologists, who were familiar with the use of PROs from prior research, gathered to try and identify the source of the excess urinary toxicity. They identified the choice to use a Foley catheter or not as the likely choice. The USBT-2 team did not use a Foley catheter in order to reduce perineal morbidity. The USBT-1 approach did use a Foley in order to better identify the prostatic urethra and to avoid placing radioactive seeds too close to it. After including the Foley catheter, the USBT patients experienced sharply reduced short-term urinary toxicity. In conclusion, using a Foley catheter to better locate the urethra may reduce short-term urinary toxicity. More broadly, using PROs, we can compare and improve complex cancer treatments based on actual patient outcomes. We are extending this approach to other cancer treatments. Thank you.